Some men start testosterone therapy and suddenly they're sleeping better than they have in years. They fall asleep faster, they wake up feeling more rested, and their energy during the day improves dramatically. But other men notice the exact opposite. They start waking up more during the night. Their partner says their snoring suddenly got worse. Some even say their sleep feels lighter or more restless. So what's actually happening here? Does testosterone improve sleep, or can it quietly make sleep worse? Hi, I'm Dr. Fashir, your men's health physician, and in this video we're going to break down how testosterone interacts with sleep, what the research actually shows, and why two men on the same therapy can experience completely different results. And there's one specific condition that doctors pay very close attention to before starting testosterone therapy. If that condition is already present, testosterone can sometimes make sleep worse. We'll talk about that in just a few minutes. But first, there's something most people don't realize. Testosterone and sleep are deeply connected. In fact, most of your daily testosterone production happens while you're asleep, specifically during deep sleep, what scientists call slow-wave sleep. This stage usually occurs during the first few hours of the night and plays a major role in hormone regulation. A study published in the Journal of the American Medical Association looked at healthy young men who were restricted to about 5 hours of sleep per night for just 1 week. The researchers found that their daytime testosterone levels dropped significantly, in some cases by around 10 to 15%. And remember, that was only 1 week. Now imagine years of poor sleep, maybe because of shift work, late night scrolling, chronic stress, alcohol use, or even untreated sleep apnea. Sleep isn't just rest. It's one of the main times when your body regulates hormones. That's why when someone walks into a clinic complaining of low testosterone symptoms, things like fatigue, reduced motivation, and lower libido, sleep is often one of the first things physicians evaluate. Because if sleep is consistently disrupted, hormone levels often follow. But here's where things get interesting. If poor sleep lowers testosterone, what happens when someone starts testosterone therapy? Does sleep automatically improve? Sometimes it does, but not always. Let's start with the situations where testosterone can actually improve sleep. When a man truly has clinically low testosterone and begins properly monitored therapy, several things often change. Energy levels improve, mood stabilizes, motivation returns. Many men become more physically active again. Those changes alone can positively affect sleep. In fact, some research suggests that restoring testosterone levels in deficient men can improve sleep efficiency and reduce daytime fatigue. A study published in the Journal of Clinical Endocrinology and Metabolism found that men with untreated testosterone deficiency often report poorer sleep quality, and treatment can sometimes improve overall sleep patterns. But testosterone itself isn't a sleeping pill. What it often does is help restore the body's overall balance. When energy improves, when body composition improves, and when mood stabilizes, sleep can naturally improve as a side effect. But this is where we need to talk about the other side of the story, because there are situations where testosterone can actually make sleep worse. And one of the most important reasons involves a condition called obstructive sleep apnea. Obstructive sleep apnea occurs when the airway temporarily collapses during sleep, reducing oxygen flow and causing repeated awakenings throughout the night. Many people who have sleep apnea don't even realize it. They simply feel tired during the day, or their partner notices loud snoring. Now here's why this matters. Some studies suggest that testosterone therapy can worsen sleep-disordered breathing in men who already have untreated sleep apnea. For example, research published in the Journal of Clinical Endocrinology and Metabolism found that high-dose testosterone therapy in certain populations was associated with worsening markers of sleep apnea. This doesn't mean testosterone causes sleep apnea, but if sleep apnea is already present, testosterone can sometimes make the condition more noticeable. That's why responsible physicians often ask patients about symptoms like loud snoring, daytime fatigue, or witness breathing pauses before starting therapy. And that leads to something many people misunderstand about testosterone therapy. Hormones don't work in isolation. They interact with sleep, metabolism, stress levels, and overall health. If someone starts testosterone while their sleep is already severely disrupted, the hormone itself isn't necessarily the root problem. It may simply reveal an issue that was already there. Now, there's another factor that sometimes surprises people. Testosterone can influence red blood cell production. This process is called erythropoiesis, and it's one reason some men feel more energetic on therapy. But in some cases, if red blood cell levels rise too much, doctors monitor something called hematocrit to make sure blood viscosity remains within a healthy range. This is why regular blood tests are part of responsible testosterone therapy. Hormone treatment isn't just about how someone feels. It's about monitoring how the body responds over time. Now, there's another hormone involved in sleep regulation that many people overlook. But before we get into that part, if you're still watching and finding this helpful, do me a favor and hit the subscribe button. It helps the channel grow so I can keep making more evidence-based content like this. Alright, let's continue. The hormone I mentioned earlier is estradiol. Estradiol is often thought of as a female hormone, but men produce it as well. In fact, some testosterone in the body naturally converts into estradiol. Estradiol plays a role in brain function, mood regulation, and even sleep. When hormone levels shift, estradiol levels can shift with them. If estradiol becomes too high or too low, some men may notice changes in mood, fluid balance, or sleep quality. This is another reason why hormone therapy should always be monitored by a qualified physician rather than managed blindly, because hormone balance is exactly that, balance. Now, stepping back for a moment, it's important to understand that sleep itself has several stages. There's light sleep, deep sleep, and REM sleep, which is the stage associated with dreaming. Deep sleep is particularly important for hormone release, including testosterone. But things like chronic stress, alcohol, poor sleep schedules, and sleep apnea can fragment those sleep stages. So when someone says, testosterone ruined my sleep, the real question is often more complicated. What was their sleep quality before they started therapy? Were they already sleeping poorly without realizing it? Because sometimes hormone therapy doesn't create a sleep problem. It simply makes an existing issue more noticeable. And this is something physicians see quite often in clinical practice. One patient might start therapy and say, I'm sleeping better than I have in years. Another patient might say, I'm waking up more during the night. The difference often comes down to underlying health factors like body weight, airway anatomy, stress levels, or untreated sleep disorders. So what's the takeaway here? Testosterone therapy can improve sleep in some men, particularly when low testosterone was contributing to fatigue and metabolic imbalance. But in other situations, especially when conditions like sleep apnea are present, testosterone can reveal or worsen an underlying sleep problem. If you've noticed changes in your sleep after starting testosterone therapy, either better or worse, it's worth discussing with a physician who understands both hormones and sleep physiology. And remember, understanding the full picture is what leads to the best outcomes. If you found this helpful, hit like and subscribe so you don't miss future videos. And tell me in the comments, have you noticed any changes in your sleep after testosterone levels changed? I'd be interested to hear your experience. I'm Dr. Fashir, and I'll see you in the next video.